Hello there. Hello, hello. Hi, hi. Hi, Dr. Shaista. Just waiting for a couple of people to join in. One second. One of my friends is here, Rajveer Arora. He just went bald today, so heck, this is gonna be an interesting topic for you, buddy. Sorry, one second. Men's health, men's skin and hair care. Alright, I'm just gonna post this with Dr. Shaista. Alright, I think I've put that up as well. Can comment. Okay, yeah, Raji's already laughing. Alright, we're gonna get you on board. Doctor, how do I do that? There you are. Okay. Yeah, she's joining in. Super awesome. Good evening, everybody. Thank you for joining our live. We've got Dr. Shaista Kazi. She's probably just going to accept, and there she is. Hello.
Hi, Kunal.
Hi. How are you doing, Doctor?
I'm great. I'm so happy to be back on your page with you this time.
Yes, yes. Even I'm excited. So Sonam's like, hey Kunal, you know what? You're normally very concerned about your skin and this and that. Why don't you go live with Dr. Shaista and she'd like to speak about men's skin and hair. And I'm like, you want me to go live and talk about men's skin and everything? She's like, you're the only guy I know who's always concerned about his skin, and you need to go out there and create conversation so everybody else who's out there who's like trying to speak about men's skin, right?
Absolutely.
It's not a very normal conversation, men talking about their skin. Arey yaar, ye ho gaya, ye ho gaya.
True.
Hair, yes, hair always happens. A lot of my friends are always talking about hair, but skin, very less, very less people.
So, it's such a nice topic, and especially because tomorrow is Father's Day. So, happy Father's
Yes,
Day to all you guys, because really, I think this is the most important relationship in everyone's life. Especially as a daughter myself, fathers are everything to us. So,
yeah.
happy Father's Day to you also from your two little ones and all the
Thank
others
you,
who
and
joined.
to everybody else watching as well. And daughters are the best. I have to hashtag
I
that.
agree. As a daughter, not as a mom. I'm too much for my boys. So the thing is that
Really.
men's skincare is so important, but it is something which has become somewhat a taboo, especially in our country, to even talk about it. So if a man actually discusses his skin, that's considered very sissy of him. You can say that, or you can say that he
Yeah,
goes into a different category altogether, vain. When actually it's not at all like that, because skin is the largest organ. I keep saying this, but it's so important. It is the largest organ of our body, and it is actually what you see when you look at someone. You can just
correct.
see their skin. So if you don't look after your skin, you're not going to look good. You're not going
Yeah,
to feel good. Also,
yeah,
skin is just a mirror of what's happening, within your body. So it's a simple thing. Like if you have asthma, sometimes it can show on your body in the form of an eczema, a rash, psoriasis. If you
correct.
have a hormonal imbalance, you can get acne because of that. So it's very important that you don't treat skin, don't give it a stepchildly treatment, and actually look after it well, so that it can last you. It has to last you for your whole life.
That's so true. And I remember having this discussion with you when we decided to go to do this Instagram live, right? And you said that what happens inside your body is what reflects. And
Absolutely.
boys, fathers, they're usually so busy going from their day-to-day life to working to trying to get food on the table, doing that kind of stuff, that they forget to take care of their skin, right? I think
Absolutely.
eventually it does affect everybody. It's just that that's not the priority, or they forget about it, and general conversation does not happen outside about it.
And basically,
uh,
men are not multitaskers like us, unfortunately. So we look after the house, we look after our children, we work, and we look after our skin. But
yeah,
I think men feel like already itna sab kar rahe, this is like last priority. But please don't do that, because besides skin being so important for what's happening inside the body, the way the men want their women to look good, we also want our men to look good. We want you all to
that's a
put your best
powerful
foot
one.
forward.
That's a very, very powerful one, right? So,
Yes, so it's
on
so
your mom,
important. Appearance is in this world, unfortunately or fortunately, what shows sells. You know, you need to look good as well to feel good inside.
yeah, that's true. That's true. That's so true. And I think you're being vocal for local because we're always
No,
we're
so it's
always looking
very
at.
true, you know. And some of us, some of y'all, some men are blessed with good genes, but you should not even take that for granted because it's not going to last forever.
Yeah,
So,
that's true.
just the way we also after 30 start looking after ourselves a bit more, even if you've
Yeah,
done nothing. Like, I know men who use just a fully laureate sulfate laden soap and they wash their hair with it and they wash their face and body and everything with that one body wash
yeah,
they get from Noble Chemist, and they're just like, we are sorted. But now you can't do it. It won't last because your hair needs special care. Your face needs a little better care. And
yeah.
even your body. So what better time than now to start?
That's true. That's so true. So, why don't you take us through the basic process of
Sure.
what is something that a guy should be thinking about when it comes to skincare? Let's start with skincare for your
So, let's divide
basic.
it into skin and hair because most of my patients, even today, the male patients come in for their hair because that's their crowning glory. They don't feel bad obsessing about it, and they're really scared of losing all their hair because it is a possibility. So, hair
Yeah,
care we keep for the last part of the session, so people stick on and do listen about the skin too.
yeah.
So, going to the skin, let's divide it into the face and the body. Both the skins need to be looked after in a slightly different way, but both need to be looked after. So, coming to, let's start with the body. Many men work out, they work long hours, they wear, sometimes some of them are even wearing blazers, and the entire shirt is buttoned up, so they're sweating a lot. Then they love their hot showers. All
Yeah.
these things are very detrimental because you're actually sweating, your skin is getting extremely oily, and you are increasing your chances of getting fungal infections and rashes, which you don't then like to talk about. But it's bothering you, and you cannot be at your productive best. If you have itching, if you have a rash, if you're just not comfortable, then you start getting pigmentation in those areas because that's how it starts healing if you don't treat it at the right time. So first thing, please stop the hot baths. Lukewarm baths are not relaxing, they are not de-stressing. So go in for a cold shower then. It takes some time to get used to it, especially if you're used to, like a steaming hot bath. But a cold shower is also very relaxing once you get used to it, and it will actually seal all your pores. So, it's very good for the skin
Well,
compared to
I
a
didn't know.
hot
So
shower.
once a guy actually comes back from work and had a long day or workout, whatever, going for a hot shower is something which is wrong for the skin. You should go for a cold shower.
Anytime. A hot bath causes the skin to sag, it causes fungal infections. And I know that men like to do it because my patients are like, doctor, stop anything, don't stop our hot showers. That's the 10 minutes that we just feel good, but it's very bad for your skin. So please stop. Another thing, don't reuse your towels because I know a lot of men like to, use the towel once, then they just keep it, then they reuse it 2, 3 times, then
Yeah.
throw it for a wash. Don't do that because that is what again spreads fungal infections. Use a thinner khadi towel instead of the thick Turkish towel so that they dry faster. So it's not an
Yeah.
issue for whoever's looking after the laundry department. But please do not reuse your towels. Again, if you're prone to sweating a lot, use an antifungal powder regularly, maybe 2 or 3 times a day. That will prevent the infection from sitting in, and it will not allow your skin to become too oily and too sweaty. Do
Oh, that's
not use
interesting.
a soap which kills 99% germs. I don't want to take any names, but those kind of soaps are bad because they are killing the good bacteria along with the bad bacteria, and that is giving a breeding ground to the fungus. So we don't want that. Use any mild soap. You can even use your child soap if you have a baby soap in the house. That's
I'm doing
really
that all the
good.
time.
Yeah, because you can even wash your hair with it. It's not going to cause harm rather than doing it with one of
Yeah.
those strong soaps. So if
Yeah.
you're
Yeah. Yeah.
fine with that, you can even do that. Or you can use anything which is strong, but not one which has got such a high, either a great alcohol percentage or a great antibacterial property, because that's actually bad for the skin.
Okay.
Coming now from the body, we'll go on to the face, which is the most important thing because that's what we're going to look at when we see you. It's going to be your first impression. And
Yes.
whatever, if you're a great orator, you're very good. When you do go in for an interview or when you do meet someone, what they first see is your face. And by face, I don't mean you need to be good looking or you need to be of a certain color or height or something. You need to put your best foot forward. It should look like you made an effort, like you've looked after yourself and you're well kept. So for
Correct.
that, you have to look after your skin. It's essential. So acne,
Love yourself first.
yes.
And how you look actually defines if you do love yourself first or
So
not.
men do love themselves first. I'd like to say that it's not like us
Yeah.
women. It's not like you don't love yourself, but love yourself correctly is what I'm saying.
It's just not out there. It's just not out there, right? I
I
think
think
men
you
should
just don't like
start
to
having this
admit the
conversation.
love, yeah. And start the love with how you look, so even it'll be a good and lasting thing.
Yeah, yeah,
Yes.
that's true. All right.
So, acne is a big issue with men. And generally
Yeah,
it starts in the younger years, even in your teenage years. And there are big, nodular cystic, like actually pus-filled, painful pimples which come in. Boys don't like to
yeah,
talk about it, forget addressing it. And if someone mentions it, they're like absolutely put off with that person who's, brought it to their notice.
definitely, definitely. Yeah, 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 yeah.
But acne is not something, it's not like a skin color or a body type that you need to accept it. Acne is a
Okay.
skin disease and you need to treat it. So please treat your acne earlier, because the earlier you treat it, the lesser the chances of them forming marks and scars, which are, going to stay on and very difficult to treat.
Confession,
Yeah.
confession. Yeah. So I'm one of those guys, and if you notice in the live as well, there's a small filter on my side of the page because
So you
yeah, I've
don't
been one
need a
of those
filter.
victims to acne.
Yes, I'll
I've been
come
one
to it.
of those
Even if
victims.
you've not treated the acne, though it would have been very good if you had treated it at that time. So in case
Yeah,
your kids get it, if your son gets it too, I hope not, but at a later age, please start
yeah.
his treatment as soon as he gets it. It's a 6 months treatment. We can get him rid of the acne for good without causing the scars to come in the first place. But
Oh
now
wow.
if the scars are already here, we also
Yeah.
have
What happens to
procedures for
somebody
that.
like me? Like I already have my scars, right?
Exactly. So we need to assess you. We need to see you under a woods lamp. We know exactly how deep your scars are. We've got
Yeah,
amazing machines. So we have the micro needling RF. They're small
yeah.
needles, but it's not painful because it's like acupuncture. It's that. And plus, male skin is a little different from female skin. So it's a little
Correct.
thicker, and
Yeah.
the tolerance will be much better in your case to these procedures. So there's
Right.
RF, which is radio frequency. So those heated needles actually break the bonds which are, the scar tissue. It's holding it down. So when we break
Okay.
this, it will just lift it up and flatten it out. So
Okay.
that will work really well. We have fractional CO2 lasers, which are a little,
Okay.
I won't say painful, but you have to have a good tolerance. We put top lap again. We give you local anesthesia there, so you don't feel it much. And it gives amazing results in fewer sessions for your scars. So your scars are still treatable, not only with creams now, because, you've waited on it for quite
Yeah,
some time,
so I was
but
going
you
to
can
get to
still
that.
treat it.
Like my scars came to me when I was probably in the bracket of 15 to like 18, 19, right?
Yes,
And after that, then they reduced. So it's been more than 14 years that I have the scars on me.
that's fine. We
They're
can
still
still treat
effective,
them.
yeah.
So, isotretinoin is a wonder drug. It works for acne as well. It's a vitamin
Yeah,
A derivative, and it
yeah.
also works for the scar. The only thing is it causes a lot of dryness, but we have a lot of things we can combat the dryness with too. But
Okay.
this also works for scars. If this is done along with the correct laser, we can
Yeah,
still treat your scars, most of them. And if anything, little bit is left and you're still cosmetically bothered by it, there are fillers for it. But
fantastic.
in most
So all
cases, just the
all the
laser would
moms,
be enough.
we've got a lot of moms and a couple, if my friend is still live. Uh, is there any sort of like a vitamin or any basic caretake that they need to do for their day-to-day skincare? What
So
kind
there's,
of,
I'll
or
tell
have
you
you got
five
Kyle
things.
already asking creams? Yeah,
I'll tell you five things. First of all, your face wash is extremely important. Now, most men have an oilier skin because the
right.
sebaceous glands are larger. The oil glands are larger in male skin than they are in female skin. So you need
Okay.
something strong. If you just use something like an Episoft or, like a cleanser, you'll not
Yeah,
feel that clean. But having said that, please don't try to make your face squeaky clean. So,
right.
जब बर्तन लेके उस पे ऐसी आवाज होती है ना, we check the button is clean. We don't want
Yeah,
that in the face. We don't want it to be that dry and that clean, because that means
right.
you have depleted the entire barrier. And now your
Correct.
body is going to get a message that the skin is really dry and it's going to produce excessive oils to combat this. So we do not want to dry it out and clean it to that level. We should just feel a little clean and a little moist, dewy, and that's good. So you
Correct,
can
correct,
use
correct.
something, you can use a good face wash with a little salicylic acid in it. Salicylic acid are beta hydroxy acids. They are a little different from what glycolic and lactic acids. They are oil soluble.
Okay.
So even if there is a lot of oil on your face, they will still dissolve into it. They will penetrate deeper into the skin. And the dead cells that collect on the upper layer. I was
Yeah.
telling Sonam in one of the last chats that we spoke about what happens
Hmm.
after 30. So our cell turnover rate gets really slow, more in men than in women. And all the dead cells start collecting on the upper layer, and the reflection of light starts changing. So you start looking very dull. So, men say that they don't care about anything else, but they're like, we don't look like we used to. We look very dull now. Like there's a grayish tone
That generally happens,
after
So I've been
30 and
using.
as you start aging.
Yeah, in fact, Sahil just joined in and he asked a question as well about a charcoal face wash, and
Yeah.
I've been using a charcoal face wash for some time now. Uh, we've got Tarun Tatani added. I think he's the only guy who's most comfortable about talking skincare and hair
But does
care.
it show on his face? It shows on his face that he's looking
Yeah,
after
yeah,
his skin. Yeah.
yeah.
So then if
So
you want
he's
to
the
look
guy
like
we
that,
actually
please look after your
I would
skin.
say he's the guy that we're referring to, the guy who normally takes care of himself, and then when he comes out, it shows,
So my
right?
husband also looks like that, but he's genetically blessed. So we'll have to thank my in-laws for that more than his skincare.
Super awesome. Hey,
So
Tarun, we're
right
talking about
away,
you.
yeah, yeah. So I sent a message to Namrata, so maybe she passed it on to him. Thank you for
Yeah.
joining us. Yeah. So, the thing is, I was telling you that charcoal is good, but you need to
Yeah.
be careful. If you're using something with a salicylic acid or a charcoal, then it
Yeah.
is essential that the minute you wash your face, you keep a moisturizer and you put a
Okay.
little moisturizer on the face on a semi damp face. So you don't dry it out completely, never scrub dry your face, and put a
Yeah.
moisturizer instantly because we don't want the body to misunderstand that your skin is dry.
Yeah. Okay.
We
Okay.
just want you to be clean. We want to wash off the excess debris, residues, oil, but we want to retain the moisture. We don't want dehydrated skin at any cost. So you can
Correct.
take
Correct.
a mild moisturizer, anything like an Emoline or an Aqua Soft or an Acne Moist. These won't cause you to break out or feel more oily and greasy, and it will trap the moisture in so your skin is not taut and dehydrated. So
But
this is the
important
face
to know
wash.
that it needs to be done on a damp face, not on a dry face.
No, not on a completely dry face because we want that
Because
dampness to get trapped in. We want the moisture to get trapped.
Because so Sonam's usually doing her moisturizing stuff after the kids go to sleep,
True.
and I'm like, give me also some, and then she'll just pour whatever she's pouring, and then I'd go and I'd do it all over
So
wherever I
see,
can. Right? So
it's
is
very
that
good
is
to
that
do
something
see
good?
something. No, but the moisturizer that she might be using. See, now she's also crossing 30, so her moisturizer might be a little richer, especially if her skin is not oilier. It might get too much for you. If your
Okay.
skin is more on the oily side. So it's very important to understand your skin type and you invest in a cheap gel based moisturizer. You don't need a very rich thing and don't
Okay.
share a product because it may not be the right product for you. So I would
Okay.
definitely recommend, at least 3 visits to the dermatologist in a year. So it's not
Okay.
like we have ladies coming in every month or every 2 months. If you can't do that because you're busy or you feel it's too much time spent on yourself, at least thrice a year. So any early signs of aging, any changes in the skin, sometimes the skin just changes. It goes from oily to dry because of age. You don't know how and when that happens. So you
Yeah.
sometimes have to change your products. So thrice a year you go to the dentist, thrice a year you go to the dermatologist, you look after yourself.
Correct. Correct.
So this is
So
a face wash,
to put
sunscreen.
it into numbers, whoever is watching, sorry to
Yeah.
put it into numbers, whoever is watching, every 2,900 hours, you have to remove 1 hour to go to a dermatologist
So your
and
math is
another to
very
go to
good.
the dentist.
Yeah,
Every
please, at
3,000
least
hours. You
minimum.
got 3,000 hours to yourself, yeah?
And you can either come in with your wives or you can come in. I have a lot of patients who just come in on their own because they don't want to wait, while the wife does the entire thing. So we're like, no, doctor,
Yeah.
you come on our own. We just do 1, 2, 3 and we're out. So we
Yeah.
rush them because we understand that they don't have time and they don't have patience. So they can just finish up fast. Even if they come in for like their routine hydrofacial 3 or 4 times a year, we can
Yeah.
check the skin at that time and we can see any change and we can stop it. We can prevent it at the right time.
Okay. Okay.
Yeah,
Super
so then
awesome.
we were going on to sunscreens, which I
Yes.
cannot stress enough. If you do nothing else, also please do this because you're driving to work, so the sun is hitting you right on your forehead. This is the place where most men start getting the pigmentation. Or,
Right.
right? So just above the
I have
eyebrows,
like a
and
line over
you
here.
know, there's a bulge and you'll get a line here. And then
Yeah.
you will not like it, and then if you're conscious, you'll ask your wife, give me some concealer, and you'll dab it in a very wrong way, and it'll look wrong. And if you're not
Yeah.
conscious, you'll just be left with that feeling underconfident about it. So
Yeah.
there are treatments for it. We have peels, we have lasers, but the best thing to do is to prevent it from going forward is to use your
Sunscreen.
sunscreen.
Yeah.
50 SPF is the minimum guys need because they are not going to remember to reapply. Still,
Yeah.
I will tell you reapply every 2 hours, but 50 is minimum. Physical sunscreen is better for guys than a chemical one. So something with zinc oxide and titanium dioxide. But if
Any
you see,
particular any particular brand?
Neutrogena has got amazing products. Clinique has got very good products for men. So you can use any Clinique product. Just check the SPF, the PA as well. So the PA is the UVA factor. We want a broad
Yeah.
spectrum sunscreen covering UVA and UVB both, so that you are protected from the aging effects of the sun as well as the tanning and pigmentation.
That includes zinc, right?
Sorry.
So the basically the molecule combination that you're using that has zinc in it.
Yeah, so you look for zinc and you look for titanium dioxide. But just remember one thing, if this sunscreen makes you feel too whitish, like when you apply it, you feel there's something on your skin, you're not liking it, you can
Yeah.
also use a chemical sunscreen. The only
Okay.
difference is that the physical sunscreen will just reflect off the UV radiation. It won't absorb it and convert it to heat. So you won't have that feeling like, I'm feeling very oily, very greasy with the sunscreen. Some men complain, I don't like it. That won't happen with the physical sunscreen, and it will give you a
Oh my.
higher level of protection.
Oh, fantastic. Tarun also commented he's put his insight into it. Multani mitti once in 10 days.
We should have one session with him also to motivate the
His
guys to
hacks.
go ahead.
I
Yeah.
have spoken. I have spoken to him about healthcare. I have spoken to him
Yeah.
about working out, and his hacks are very natural to the point. He just come up, Kunal, मैं ये करता हूँ मेरे चलता है. You have to do this.
Yeah. And again, it's not, one rule fits all, one hat fits all, because especially for men, the skin
Yeah.
types are so different, and because you've never found out what skin type you have, you might just be using, the wrong products. Even dark circles is such a common thing in men because, they
Yeah.
sleep in so late. Netflix is on, the phones are on, computers are on throughout the day. So the eyes
Yeah.
are not getting any rest. They're becoming very dry. So I
Yeah.
also recommend, eye drops, the tear eye drops, refresh eye drops. Just keep them
Yeah.
with you and keep putting it every 2-3 hours into your eyes if your eyes are getting dry, so that you
Yeah.
don't rub your eyes, unknowingly, maybe in the evenings or at night when you're tired, because that causes the capillaries around the eyes to break and it will give a grayish hue to your eyes. And then you look
Okay.
tired all the time.
Wow. Yeah, that's true,
So
man.
we
So
went in
true.
for a
So
face wash and a sunscreen. And under eye cream, if you can, it's superb. You can use something with a vitamin C and a vitamin E. You can even use that on the entire face. So it's not necessary you need to just restrict it to your under your eyes. You can
yeah.
use it. Clinique has another excellent product with hyaluronic acid. So hyaluronic acid is a molecule.
Hyaluronic. I'm
Yeah,
writing all this down.
hyaluronic.
That's why I'm asking you. Sorry.
Okay, so then I'll
Hyaluronic.
make it simple. We use a good face wash with salicylic acid. We use a
Yeah.
sunscreen with a 50 SPF broad spectrum, so that
Yes.
covers UVA and UVB. Then the
Yes.
second thing we use a vitamin C and vitamin E combination serum at night for under eyes and entire face.
What do you hyaluronic serum? What? Sorry. What is the serum?
Vitamin C plus vitamin E. I can give you the name
Vitamin.
later too if you want, but for now it will be any combination of a
So
vitamin C and a vitamin
there are
E.
a lot of because there's so much happening. There are a lot of people you can see they're joining in now, right? So
Yeah,
just to take you all
you can
through
recap.
whoever's joined in now, uh, the first myth she's busted is you got to stop taking hot showers. No hot showers for
I'm
men anymore.
sorry.
Just cold showers or like even avoid lukewarm if you can, but cold showers would be the best ones.
Lukewarm is fine,
Not
but
to
it is
use.
not fun.
Okay.
Yeah, lukewarm is not bad for
So
the skin.
to people who are hearing the cold shower thing for the first time, uh, I've been researching a lot about just general cold showers, and it is the best thing for you to do even in the mornings. because it gets you out of your comfort zone. So a cold shower tells your brain, "Hey there, attack," and it brings you out of your normal comfort zone. So men who are actually doing a lot of work things every day, you don't want to be tied up to what you normally do every day. You need to innovate. You need to improvise. You need to come out and get something more done. So cold showers usually do help for that as well.
Also,
But the
in
one that was busted,
the electricity meter, if you've ever gone and taken a look at the meter, if the geyser
yeah.
is on, it goes tick, 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 tick. You'll be saving a lot of money too with the cold shower.
There you go. That's the key behind
So,
it as well.
so
Oh
men
yeah,
need to have a
definitely.
motivation. Yeah.
Yeah.
Nothing runs the electricity as the geyser. So let us use it, please, but you don't need to use it from now on.
So there are a lot of women on the live as well. So hot showers are cool for women. That
No, no,
for
no,
their
no.
skincare. No.
Hot showers are not good for anyone. It causes the body to sag. It causes the skin to sag. It
Yeah.
opens up your pores, and then when you go out, it's going to just collect dust, get clogged. So hot showers are
All right.
not good even for kids. For kids also, we recommend lukewarm baths, quick and out.
All right. All right.
It basically
So
depletes the natural barrier of the skin. So anything hot, even steam, we've replaced steam with cryo to open up the pores. Even in our clinics, we don't use steam anymore.
so steam and sauna too is not good.
Steam is not good because what happens is that anything so hot causes the body skin to sag in the long run, and
Yeah.
also it opens up your pores, and then if you go out, you're actually going out with absolutely open pores.
Okay. Okay. We've got Irshad for you asking sagging skin. Is there a solution to that? So sorry,
So
1 second
yeah,
before we move on. A lot of new people. I'll just let you know. Cold showers, number one, myth busted. No hot showers, guys. Men, women, both. Though we're talking about men's skin over here, you guys gotta use this for your hubbies, brothers, boyfriends, everyone. So no reusing towels. Obviously, we can use baby soaps. Not to use all those fancy soaps. Try to keep your skin safe with. Non-acne stuff. So acne is a disease. You need to get it treated, and as soon
absolutely.
as you identify you're getting acne, go to a dermat, get it checked because it can be treated well enough that it does not come back. If you've already got acne, Dr. Shaista here has a lot of high-tech stuff that she's been talking about that she can take all these problems out. Probably I'm going to be your first customer coming over there because I'm really annoyed with all this happening. Hacks, she's on 5 hacks. She's given us two already. One is face wash. Make sure you're using that with salicylic acid. And the other thing is applying sunscreen because men are usually out and about. Using sunscreen is very, very important. 50 SPF, including zinc, titanium dioxide.
So
And
that, and then we told you about the moisturizers. You'll be using a
that,
moisturizer after your face wash. Something
yes.
very light, maybe like an emollient or an acne moist or an aquasoft. Nothing
Yeah.
very rich, nothing very high end because the high end ones are thicker. You can
Yeah.
use the unique one with the hyaluronic acid. That's really good too.
Okay. Okay.
So these are the few things that you can do. You can also start using retinol if you're bothered by pigmentation, acne scars, and fine lines. If all these things are coming up now, which are signs of aging, you can start including a retinol maybe 2 times a week or 3 times a week. Some people use
Okay.
retinol even plain, but I like to give it to all my patients to be mixed with a moisturizer so that you don't get intense dryness and you don't
Okay.
feel that you are not tolerating the product and stop it completely. So I would recommend mixing it with your moisturizer, starting using it 1 hour at night, and if it suits you, slowly increasing it to 2 hours, 4 hours, and then full night.
Okay. So you said there were 5 hacks. Is that one of those?
Yes. So I said retinol, I said a
Yeah.
face wash, a
Yeah.
sunscreen, a moisturizer, and a
Yeah.
night serum with an active ingredient. Either it could be vitamin C and vitamin E or hyaluronic, depending on what you feel is bothering you more. Is the pigmentation bothering you? Is the sagging and the fine lines bothering you?
Oh, fantastic. Fantastic.
So it's not much. It's very basic. Once you start
Yeah,
doing it and becomes a habit, it's not even going to take 5 minutes.
that's true. Like,
And you can
Dr.
invest
Naim
that
said.
much time. I'm sure guys have the time.
I am pretty sure, I think once guys start doing it, they like it more, they'll do it
Yes.
better, and they'll do it longer. Like
Yeah.
Dr. Naim said, Tarun's routine, skin routine in the night is longer than mine.
Yeah. So there are guys who even do 6 steps. But what we are talking about today is for the lazy guy who's done nothing yet.
Yeah,
So we are
yeah,
just
that's true.
starting him off, Yeah. You the once you start, then there's no ceiling. You can keep looking better and better. Give a
Super
complex
awesome.
called a vibe.
So again, something that we were talking about during our call
Yeah.
is you said, I think you said it in the live as well. I'll just repeat it, that usually men are the ones who are saying that the women should look good, but women also have that thing that the men should look good, and
Absolutely.
why
Why
not,
not?
right? Why not?
Why
Yeah,
not?
and
Yeah.
the guys need to think that way, and
You know,
since
earlier it was like that. The woman was pretty, the man was rich. And the woman cooked at home and the man went out. Now both are working and both are rich, so why not both look good?
definitely, definitely,
Let's
and
do
I think
everything in partnership. So look after
that's so,
yourselves, yeah.
that's so true. That's so true. We're in it
All
together now.
multitasking. That should be in a good generation to be born in, where we
Oh,
have
we are in a
opportunities to do
wonderful
it.
generation to be born in. Yeah,
And
wonderful
there are easier
generation.
ways. It's like earlier there was a lot of effort going into skincare to reach a particular thing. Now, if you're
Yeah,
lazy, we can do it for you. So, instead of thrice a year, you can come in maybe 6 times a year and you have lesser things to do at home.
and you
Which
have
is
a
the
professional
correct.
taking care of it.
Yeah,
Yeah,
absolutely.
yeah. Okay. Something's wrong with Dr. Shaista Kazi. Buffer. Sorry.
Hello?
Yeah, sorry, we lost you for a second. And again. Yeah.
So, there are so many people who've gotten into cosmetology now who are not dermats, who don't have much knowledge about skin. Then
Yeah.
that could be dangerous, especially if you're going in for something with a laser, because we
Yeah.
don't want some kind of, we don't want you to have a bad experience and not want to do it again. So, as far as the male patients are concerned, we are even more careful because they are very hesitant in the beginning because they're not as motivated to, and plus, they've never done anything. So, we take
Yeah.
extra care to see to it that they have no pain, they have a great experience, and they are out in and out fast so that they feel like coming back.
Super awesome. I think I'm going to do a live coming to your clinic and getting this
You
whole
must,
thing checked
yeah.
and fixed. And even if you're treating on it, right, I'm happy to go live. Let people see how quickly somebody can go in, come out, and make sure they're
Absolutely,
taken care of, and
absolutely.
especially guys.
Seriously, absolutely.
So
So,
out
while
there
we're
for you,
talking,
out there for you.
absolutely. While we're talking about acne, I would also like to talk about the beard.
Yeah,
So, because it's really come back into fashion now with all the cricketers and all posting, having beards, and because some of
yes,
the guys are they want to look a little mature, so again they are having a beard. So there are
yeah,
a lot of things going with the beard. Sometimes people are breaking out and getting acne around the beard. In that case, I would request you to shave the beard. Let us treat your acne. Give us 3 months. Once
yeah.
it's gone, you can regrow the beard, because the folliculitis that happens when you have a beard and you have pimples over there is very difficult to treat, and then it's just going to become a very messy affair, and an unkept beard doesn't look good at all. It
Correct,
needs to
correct.
be really well maintained. Again, some men have this issue. A lot of my patients, because I had asked for some of the questions earlier, so I'm just going into what they've asked me. They have patchy growth, so there are patches in the middle of the beard where the hair doesn't grow as well, and then they can't grow out the beard nicely because of that. So there are very simple treatments for that. We give tricot shots, maybe four or 6 times. 4 times you have to come in, and the growth becomes even, and then you can grow your beard as you want. You don't need to worry about that.
Okay.
Another thing we do is laser hair removal. So we can actually shape your beard. So if you want that Virat Kohli look, you can actually get it without having to shave in that direction every single day to
Hold
maintain it.
on, hold on, hold on,
Yeah,
hold on, hold on, hold on, hold on. You said you can do a laser that I could always have that beard coming,
exactly. So
or
it'll
would it
always
be?
go.
It'll be like a
Back.
one-time thing, or it'll be like forever thing.
No, so we'll have to do around 6 to 8 sessions. And then once we are finished with that, then whenever you grow your beard, it'll only grow like this. Like it will not grow anyhow. Some people have a beard and then it's going like that.
Oh, I could
They'll,
have like a perfect shape the way
yeah,
I wanted to
absolutely.
come. That is amazing.
So you can get that done. So then you don't need to bother, because already it's people are growing the beard. Some of them are growing it out of the laziness of not shaving, and then if they
Yeah,
have to shave and maintain it, then they're like just let it grow anyhow. So we don't need to do that. And the laser is painless. It's FDA approved, so it's a great option. We also do it for the ears. Some men get hair on their ears, and it's
yeah,
very irritating to shave that. Yes, so that
yeah,
can
yeah.
go off. That hair can be looked after. Then the men who are into bodybuilding and they want a clean shaven look continuously, we do
Yeah.
full body laser for men. And it's because there's thick dark hair that
Yeah.
the lasers respond superbly to that compared to the finer hair in women. So you need
Oh,
lesser sessions
fantastic.
for better
Yeah.
effect.
Oh, that's damn cool. Yeah. Superb.
So
I'm excited.
yeah.
I'm excited about the beard still. Okay, not about the
Yeah.
body hair. I'm still
Yeah.
excited about the beard.
So that's an amazing thing. People don't know that it's possible to do it. So it's a
Yeah.
lovely thing which can be done. And even when you have sagging skin, like you just
Yeah.
mentioned, for sagging skin also, if there is a beard, most of it gets hidden. Then
Right.
you don't need to bother that much about it. Though we
Yeah.
have amazing treatments for the double chin, for the sagging skin.
For all the guys who are watching, double chin beard, best hack.
So for the double
But
chin, I'll tell you a simpler thing for
we,
the double chin.
yeah.
I specialize in PDO threads. So there are small needles with threads. We just insert the threads. The threads are very safe. It's the same thread which is used to tie up the uterus after a delivery. So it gets
Okay.
self-absorbed. You don't need to remove the thread ever. So when we put it inside, it lasts inside for around 2 months. Post that, it will dissolve, but there'll be a silicone meshwork which will form around the thread because the body is seeing the thread as a foreign object, like a foreign body. So it's going to attack it. It's going to hold it up like that, and the chin is going to be remain like that for up to 2 years.
Like this.
How many threads you put, it depends on that. Yeah,
Oh, this could actually happen.
it can. So if there is a fat component also, then we have to first deal with that. So we get these fat lipolysis injections, which are not very painful, again
Yeah.
with local anesthetic. So we dissolve the fat in 1 or 2 sessions, and then we put the threads. So when there's no fat and it's just loose skin, and we can tighten it very easily.
So this is crazy. I'm coming to you as soon as lockdown is getting over.
Lockdown is over, just come. We have all PPE, sanitization, everything.
All right, Ishad for you is getting curious. The wrinkles. He's also messaged earlier for the sagging skin, and
Right.
now about the wrinkles. Anything you have? Any comments you have for that?
So again, for wrinkles, now if you start looking after your skin early on, now, like in your 30s, you can prevent wrinkles and push it a bit. But if you've already got a few, Botox again is a very safe thing, and it is very good for men because it's a one-time thing. So it's not Botox is not something that we just see on the Hollywood stars. There are
Yeah,
so many people doing Botox whom we don't even, because especially in our country, everybody wants to be secretive about it. So even the men, they're like, it should look like I've had a good facial. No one should know that it's Botox, especially
yeah.
because there's so much weight loss. Nowadays people are going into these fat diets, they're losing weight, and it's leaving you with wrinkles and sagging skin. So
Yeah,
in that
right.
case, a little Botox around the eyes, little bit on the forehead will give you a very ironed and very clean, shiny look. That's what Botox does. Another thing
Okay.
which botulinum toxin does is, there are some men who are grinders because of so much stress. They're constantly grinding when they're thinking. You're developing your masseters when you're doing that. So you have a base heavy face. So you
Yeah,
look older than your
this thing
age.
pops out. Yeah, yeah,
This it looks very well developed, and this is not the muscle you want to develop. It's not like your biceps. It doesn't look good big. So we can just inject your masseters and you're good to go. So we just inject. You need a lot of units, but it's not painful again. We inject this,
yeah.
and up to 6 months. You can check out at my page later. There's an NRI patient who's been kind enough to share the pictures because our Indian patients don't like to reveal anything. You can
Yeah.
see the remarkable difference he's had in 2 weeks, and just he looks younger and so much fitter. So
Wow.
Botox can do that also. Botox, another thing of Botox, there are men who sweat a lot,
Yeah.
and they have sweaty palms, or the underarms, and it's just not going even with powder. Botulinum toxin also works excellently for this. When injected into the underarms, palms, soles, it stops the sweating.
Okay. Okay.
And it's much
Wow.
safer than using an antiperspirant
Yeah.
because antiperspirants have aluminum hydrochloride, which if it
Yeah.
enters, it has a slight malignant potential. So
Yeah. I've
again,
heard
we
about.
request men to use a DO over an antiperspirant.
All right.
It's
Super.
much safer.
Super awesome, man. And
Another thing I forgot about the beard. If you're using an aftershave with alcohol, please stop. because what happens is when you're shaving, you're just cleansing the skin completely of all oils, and then when you slap on the aftershave with so much alcohol, you are damaging your skin. It's going to increase the skin sensitivity. It can cause pigmentation in the long run. So though you like that feeling, use an aftershave cream with a more moisturizing base, not the alcohol based ones.
Okay. So no alcoholic aftershaves. Not
And
really good.
Bombay Shaving Company has some excellent cream-based ones, moisturizing. So it adds the moisture back to your skin instead of just depleting it and drying out your skin.
All right. Okay. Super. We've got a lot of questions coming on hair care.
Yeah.
Uh, a lot of,
Hair
I
is
think people
the
have a lot of issue with
men are
dry hair.
complaining more.
Yeah. Can we chat about that?
Of course. So let's go to hair. Now, see what happens with your hair is you need to look after it right from the beginning. Earlier, there was a belief that there's only a zigzag pattern of inheritance. So, we in fact, we also thought that you only get bald if your nana is bald, like your maternal grandfather, and it
Yeah.
comes
Yeah.
through him. Where that is true to a certain extent because the X chromosome, which is only in your mother, the balding gene comes from that. But you're not safe if your dad is also balding. There are some factors which also come through that. So if either your grandfather, like your maternal grandfather or your father are bald, there is a great chance that the boy will get bald. So you need to look after yourself early. You need to start looking after your hair earlier so that you can push the baldness. You may not be able to prevent it completely, but you can reduce it and push it if you look after your hair from the beginning or from early years. So
On
what you
that
can
note,
do,
there's Viva Fox who's already asked us that if there's a receding hairline,
yeah.
uh, any tips that they can try, any kind of vitamin supplements that they can take to at least delay.
So see what happens is the receding hairline that you see in males is called as androgenetic alopecia or male pattern alopecia. This is
Okay.
very different from just losing hair. Like how we lose hair, the ladies, or sometimes even the men, you just keep losing hair. Every time you brush, the brush is full of hair. That is different. That is telogen effluvium. That is something which could be because of vitamin deficiencies, B12, D3. It could be because of iron deficiency. It could be because you're anemic. So by correcting these things, by adding biotin 10 mg to your diet or taking capsules, you
So
can
how
correct.
does one how does one actually identify that what is the issue behind the hair fall
So
as soon
see,
as it
how men lose hair. If you're losing hair here and here, in these areas, like you see
yeah
most of our stars, who've taken steroids and build their bodies, they start
yeah
losing their hair here. So that's a good example to know that it is a male pattern. Or if you're losing hair in this area. So
yeah
if somebody's taller than you, they can see that though from front you're looking okay, when they look from up, there's no hair here.
yeah
Like women, we start losing hair in our parting because we are tying chotis and we are pulling our hair up. So
right.
like if you go into the Sikh community, they start losing their hair from here. The entire hairline
So
starts receding because
they're
they're
pulling it
pulling it
back
up. Right.
for the turban. Yeah,
So
yeah,
that happens in women too. Unless we are parting, then we lose here. But in men, you just start losing it here and here. This is not really that much nutritional dependent. It is more genetic, and it is something which is going to have a fight with you. So once it starts, you need to really hit hard. Castor oil does help initially if you start early. Dabbing in castor oil into those areas could help, but this is really initial. After that, we need something like minoxidil to stop the hair loss. Minoxidil in men, when started for androgenetic alopecia, might have to be used lifelong because when you stop it, you might get rebound hair loss and start losing the hair again. So if you're motivated enough and you start it, you can get new hair growth. You can stop losing hair, but you might have to continue for a very long time.
And what is this called again? Minoxidil.
Minoxidil, you get it in a lot of preparations. You get it in 5%, 10%. If you don't like
Yeah.
the alcohol base because you're getting a lot of burning, you can use the aloe vera base. You get a Mino Vera in the market, which is also very good. You get a lot of other things. There are like lotions, there are tinctures, but all that only helps initially. Minoxidil does help in the longer
A
run
little
when
later,
yeah, even with
once.
finasteride, we give you finasteride supplements, we give you biotin, but a personal consult would be much better in these cases.
All
I'll
right.
tell you now what happens in drastic cases, where your hair fall is not stopping, and maybe you are looking to get married or you want your hair to be good for at least another 5 years. You want to
Correct.
push the balding. So we have an amazing treatment called as PRP or platelet-rich plasma. That's basically a stem cell therapy. So
Okay.
the stem cells are derived from your own blood. We take blood, like you know how you do a simple blood test. We take out the stem cells, we add growth factors, and we inject it into the scalp. This is a
Okay.
very good alternative, or it is at least a very good thing to do in the beginning instead of hair transplant. So this is, more for men who are looking to get married, or who are in a good corporate field where they need to maintain their look and hair, and they don't want to lose their hair.
No, lose their hair, or because a lot of men usually realize very late that they've already lost a lot of hair from
You can
inside.
get new hair too.
Yeah.
So
Okay.
if you
So
do
PRP does
PRP,
really help getting new hair.
yes, yeah. So if you do PRP with minoxidil and oral supplements, you can get hair back.
Oh,
We have much
fantastic.
minor treatments like hair peptides, which will stop hair growth, hair
Yeah.
fall, but they will not cause new hair growth. PRP actually causes new hair growth. Again, I have got pictures on my page. You can
And
refer
it's
when
a stem cell
you've
therapy,
got
which
a
means
hair
there is no harm.
filled on the scalp.
My apologies, I missed you.
Sorry, I'm saying that on my page we have pictures which a patient has shared. After 3 sessions of PRP, their head has got filled with hair, and it's
Wow.
lasting them over 5 to 6 years.
Wow. And all right, we've got questions coming in from our
Yeah,
friends. Before I ask those questions, I wanted to ask you. So, because you're using stem cells, it technically means it's completely safe, right? You're using your own blood stem cells
it's
and then you're putting
absolutely
it back.
safe. So it is the same thing which I don't know if you all have heard of it, but abroad the stars go in for a vampire facial.
Yeah.
So they inject their face with their blood. That's what you see Kim Kardashian with like a red face. Kim Kardashian might make the men remember the vampire facial. That's why I
I
mentioned.
did not
Yeah.
know this is what it was.
So
Okay.
yeah, so that is again the stem cells, but then we don't add anything to that when we do it on the face. And in our country, it's a little less famous because people don't want to take pain just for a glow, but they don't mind a little, tolerating a little if they're going to get new hair. So when we add these growth
Definitely.
factors and peptides to these stem cells and inject it into your scalp, you do get new hair. And you can even push off a hair transplant. Like, supposing you know you're going to bald, your father's bald, your grandfather's bald, and it's
Yeah.
receding fast. We can do a PRP and help you to not do a transplant for at least the next 2 3 years. We can push it.
Okay.
We even do
We've
PRP
got,
post hair transplants to retain the hair back. So, after a hair transplant, also, unfortunately, 5 to 6 years and your hair fall starts again. So,
yeah.
if maybe 3 years later or immediately after hair transplant, you get a PRP done as well, this will last a little longer.
And what is Tucain and Finpacia? There's Rajveer Arora asking if
So,
these are
Tugain
good
is
to take.
minoxidil. It's a brand of minoxidil.
Okay. And
Top is
Finpacia.
a brand. Tugain is a... So, Finpacia is basically also, it's got finasteride in it along with it. Finasteride
Okay.
is something we don't give to females. We only give it to males for their
He's
body.
gone bald today, and I'm assuming it's with no disrespect, it's with the hair, the hair loss. So I think that's where all his questions are coming from. And
So hair loss is most of
personally,
my patients are coming to the clinic either with acne, or pigmentation, or hair loss. These are
yeah.
our main concerns. Yeah.
Wow. All right. Guys, if there are any further questions you need to ask right now, she's taken us through a lot of detailed insights about earlier we spoke about skincare and now about hair care. She's also told us about beard stuff we could do with a beard. A lot of high tech again equipment she's using for laser where we could do body hair removal. We could shape our beard in a certain way so that all the hair that comes over here stops
True.
coming.
Yeah.
Normally men, there are a lot of men who have hair coming all the way up till here as well, right? So
Mhm.
all those problems can be taken care of. You need to spread the word around with your friends.
Also,
And
I'd like to
yeah.
say something about laser hair removal that it doesn't work on white hair. So if you are beginning to gray and you want to get any hair removed, it's better to do it now before the hair turns gray because it won't work on gray hair.
Oh, wow. Okay, why
So
is
it
that?
will not,
Just out of
because
curiosity.
it targets the pigment also, the pigment cells, the
Right.
melanocytes. So once they're
Right.
gone, then it's not able to read the follicle. There are
Oh.
some machines in the USA where they do epilate the white hair too, but we don't have any in India as of now.
All
And
right,
those
guys.
are
This
not
is
as good as
this
these.
is bad
So,
news considering everybody is having gray hair by the
but
time they're
beard hair turns
35.
grayer a little later, so you can hurry with it.
Yeah.
So that's why you
We've
should
got
come now. You can't wait for the lockdown to end.
yeah. Like, go there now, get yourself decked up right now, because then you're going to look younger for the next 10 years. And you want your women to say that you look cool, right? Like, you look
Absolutely,
good.
yeah.
They want this too. Super awesome. We
Another
got
thing,
Irshad.
yeah. Another thing we just cover is the skin tags because we've got a lot of patients coming in for that also. A lot of skin tags around the neck and the underarms. It's
Yeah.
not painful at all. We give local anesthetic. It's a 10 minutes procedure again. It does require skill, but that is already there. So it does not require any further effort and we can get you rid of multiple. You know, I have patients with over 30 skin tags and we've done it in a day. So if you're
All
in
right.
that and you're uncomfortable, don't wait on. Come in and get them removed as soon as you want.
Super awesome. And we've got Viva Fox asking us, flaky, itchy scalp with little bumps can be a problem for men and women. Do any lotions or potions help?
Correct. So dandruff is again one of the main causes. We didn't cover that, but it causes acne also, and it also causes hair fall. You know, especially if it's not the male pattern and you're just losing hair, it could be because of seborrheic dermatitis or because of, you know, what we call PCK or dandruff. So just don't use the, you know, shampoos with say I don't want to take a name, but with say an all-purpose anti-dandruff shampoos, they don't help.
Yeah.
Use a normal mild shampoo, and then you get these anti-dandruff lotions in the market. You can use those. They are generally of a certain color. You massage them, keep them on for 10 minutes, rinse off. So it dries out your scalp, but not taking out the essential oils. You won't get more flaky, scaly, but it will not allow, you know, that feeling of excess oil, nor the
Yeah.
feeling of excess flakes. A
Can you
home
give?
remedy for this is apple cider vinegar. You can apply apple cider vinegar diluted in water, keep it for around 20 minutes, and then rinse off. That also helps.
Oh, wow. So, also somebody had earlier asked a question on any good shampoo for dry hair.
Yeah, so the thing is that, you know, I would not recommend any shampoo with parabens or laureth sulfates. So don't use something too strong. Don't use anti-dandruff shampoos. Most men either use their soap to wash their hair or they're using anti-dandruff shampoos thinking it's serving a multi-purpose thing. Biotop professionals have amazing shampoos for normal hair. You could even share it with your wife because it's very good for, if she doesn't mind, you can
Uh,
share it because it's a really
of
good
course.
shampoo. It's very mild. It won't lather too much and
Yeah.
don't go in for the lather because it's not needed, but it's not lather free also. So you will feel clean and you know,
What's the name again?
Biotop Professionals. They've got a range
Biotop
of
Professional.
products. They're available in either you can get it at on Amazon or even in the juice bars, the juice hair salons. They
Yeah.
sell from there.
And we've got one more question come from Muggle Bomb. She's saying, what should men do for the under eye bags?
The under eye bag. So again, now as I told you, use teardrops so that the eyes don't get dry. Also, you have to check now. You know these under eye bags could sometimes be pads of fat. In that case, you need a more detailed. You need a blepharoplasty basically. So I've trained from Thailand from Dr. Nivat. He actually does it. It's an OPD procedure, 20 minutes. In our country, mostly ophthalmologists do it. Again, it's very simple. That's if you come to me and I tell you it's a pad of fat. If it's not a pad of fat and it's just excess skin or just puffy swollen eyes, then there are simple things. When you're applying your night cream under your eye, you massage it circularly and outwards. You never just apply it. After this, you pump and glide, pump and glide. You're basically moving those bags out. And the last thing, small pinches. You can use a good hyaluronic acid serum. The Clinique one is available for men to try and move these bags out. Besides that, we do RF in our clinic just for the eyes, radio frequency. So any bags which are not because of pads of fat and just because of puffy skin, this will all flatten and you'll have beautiful looking eyes.
Fantastic. And also one question on follow up on that part only.
Yeah,
Is it
sure.
a good idea to massage your eyes?
Yeah, so one time at night you can.
Yeah.
As I told you, very gently, circular
Yeah.
out, pump and glide,
So
and
the
then
same
once.
thing that you said. That's a, okay. Okay.
Yeah,
All right. Super awesome, yeah. Thank you so much. Thank
it's
you
been a
very
pleasure.
much, Dr. Shaista Ghazi.
I hope at
Guys,
least few
whoever's
men start looking after their skin after seeing our
oh,
talk.
I'm going to go all out with this. Don't worry. I've made a lot of notes. I'm going to put it out there. And guys, whoever's watching this, right, take it out. Your brothers, husbands, fathers, let them know. Dr. Shaista Kasi is available online as well. She's doing teleconsultations. And as she said, the clinic's open now. They've taken all the precautions, so you guys can go ahead there, take your donut solutions, and start looking younger and more awesome.
Absolutely. Happy Father's Day again to all of y'all
Thank
in
you so
advance for
much to
tomorrow.
everybody else as well.
Thank
Yes,
you.
Mother Bomb.
All right. Okay.
All right. Thank you so much,
Bye.
Dr.
Bye, Kunal.
Shasta.
Thank you so much.
See you. Bye bye. Take care. Yes, guys, thank you so very much. She's wonderful. My wife's been going to her. She also happens to be a friend, and you can make out from the detailed information she's given, right? Like everything is so spectacularly put out. She mentioned everything. Like if you're using a face wash, it needs to be with salicylic acid, moisturizer after the face wash, sunscreen 50 SPF, with zinc and titanium dioxide, retinol, night serum. People who missed the very beginning, cold showers, guys. Cold showers is the key. And for hair care, yeah, there's a lot of technicality in the hair care right now. Won't be able to cover it in like a minute or something because you're going to get disconnected. Yes, sir, Rajviji, I will. And I'm putting this live online. So if you guys want to see it again, you can. And get in touch with Elegance. That's her handle for Dr. Shaista Kazi. Thank you, guys. And adios. See you soon. Happy Father's Day to everybody. Take care. Cheers. Bye.